not only your milestones, but every single step you make towards a life you want to lead. It's the celebration of all the tiny successes, because it's a whole bunch of small successes that lead to that huge transformation that we see at the end. And I'm sure Dr. Sandy Mann will talk about it, that celebrating those successes really starts to train our brain. It changes our brain. It helps us recognize how we're getting better and stronger and where the value is. Can you tell I'm excited? I'm almost breathless. So let me start. Dr. Sandy Mann is an obesity physician and GP psychiatrist with a focus on addressing the intricate interplay between medical and psychological aspects of obesity. She is a licensed family physician and a diplomat of the American Board of Obesity Medicine since 2016. As the founder of Haven Weight Management, a virtual weight management program, Dr. Van integrates pharmacotherapy treatment along with a blend of psychological techniques from both cognitive behavioral therapy and acceptance-based commitment therapy, both in individual and group settings. Dr. Van is recognized as a distinct voice with the medical community, particularly in the realm of cognitive behavioral therapy and advocacy. She's a national treasure, I added that, renowned speaker at academic conferences and frequently contributes as an expert on television media. She is joined by, and I hope I pronounce everyone's name correctly, Aashni Shah. Aashni Shah, sorry. Thomas Gewarges. Okay. And Shilpa Joshi. Did I say that one right? Shilpa Joshi. I messed them all up. And I apologize because you're all amazing people. So I'll let you all take your seats and enjoy this session.
I think it will.
Hello? Is this on? Can
Hello?
you hear me? Okay, all right. Okay, thanks for the warm welcome, Sandra, and thank you so much to Pretty and Obesity Matters for hosting this lovely event. As I was driving here on the DVP traffic, I thought, what better way to spend a Saturday afternoon to actually be learning and being inspired, and it's raining, so that helps a lot too, that we're indoors in this beautiful venue. But as Sandra was mentioning, I'm a GP. I'm a trained GP. I'm not a psychiatrist. I think she read psychiatrist, but I'm actually a GP psychotherapist, so I don't want to misbrand myself in any way. But I've been practicing in obesity for about 8 years now, and as I was in the events leading up to this particular event, I was thinking about my own milestones. Like, when is it that I thought to myself that I should be moving away from family medicine or general practice to focus entirely in obesity medicine? And I graduated in 2016. So I remember my milestone moment being when I was shadowing doctors in weight loss clinics, and them telling every single patient the exact same thing. There was no individualized treatment at all. It was just eat this many carbs, eat this much protein, and come back in 2 weeks and follow up. And I remember them breaking down in front of me and me asking them as a resident, what do you think it is that makes you eat more than what is directed of you? And they often broke down into tears even more and said, well, nobody's ever actually asked me that. And so that, to me, really suggested, okay, there's something a bit more complex than people's choices. And so I'm really excited to speak to this panel today. And what I wanted to ask first was, what was the milestone moment that prompted you guys to seek help from a healthcare practitioner and to take action? And why did this moment actually stand out as a turning point for you? I'll ask Thomas first.
Right on. Good afternoon, everybody. So one of the things that I really learned as a milestone moment was just watching a random YouTube video of an older actor named Dick Van Dyke, who was on the Dick Cavett show. And he was talking about his addiction to alcohol. And when I listened to that interview, it meant everything to me, but just with food. The way he was talking about his addiction to alcohol was the exact same way I felt about food. So what I did is I actually wrote the transcript of the interview, and I removed the word alcohol, and I replaced it with overeating. And it applied 100% the exact same way. And I actually have the transcript for you guys that I'd like to share because it was an eye-opening moment for me. So basically he said to him, explain to us what your alcoholism is. And he said, there are a lot of people dying because of overeating. Obviously he used the word alcoholism. There's a stigma about this disease. And for centuries they have been putting the blame on the character of the addict. And it is not so. There is no degeneration or loose morals or character defects with an overeater. It is a physical disease. An overeater has a certain metabolism and a glandular setup that make them chemically adapt themselves to food. And for them, it is a stimulant. Their bodies adapt to it as a true addiction. It has nothing to do with the person not being mature enough not to eat too much. It's a true addiction, and I was destined to be an overeater from birth. The worst aspect of this terrible disease is the guilt and shame. What happens is most have fairly high values, and we get into character, logical conflict. Our behavior is in conflict with our values. So he spoke about this with regards to alcohol. It's just I applied it to a completely different substance. And for me, one of the things that a lot of people don't understand about addiction to food is when you tell somebody who's an alcoholic, just have a little bit of alcohol, you can't do it. So telling somebody to have a little bit of carbohydrates or a little bit of whatever it is that really stimulates their dopamine is nearly impossible. Otherwise, it'll be easy to do. So that was kind of my milestone where I understood that I actually had an addiction to food. It wasn't anything else outside of that. That I had to understand that.
Yeah, I can appreciate that perspective, and I often describe obesity or overeating being a symptom of obesity rather than vice versa, because we tend to get that wrong. We've gotten it wrong for a long time now, so thank you for highlighting that and providing that personal anecdote. Shilpa, what about you?
So for me, I'll paint a picture of kind of how I got there first. So from a very young age, I would say about 10, I was put on my first diet, and that was kind of my introduction to this diet culture and decades-long experience of commercial programs. So I kind of became that standard dieter, yo-yoing for a very long time, and my milestone moment kind of happened at a point of significant regain after a very restrictive period. So just by way of background, I work in finance. I've always had this high-achieving mindset, and that resulted in a lot of black and white thinking of what does success look like. And I think Sasha mentioned it earlier on not having much gray area. So there's a lot of pressure. There was a lot of kind of white-knuckling my way through these really challenging programs. And so I had this really strong desire to make a change. But what had ended up happening was it exasperated and actually created a real challenge of disordered eating. So I hit a point kind of finally after a very long time of being on this path to knowing that I have to do something different because it's clearly not working, and the mental toll and mind share it was consuming over everything that I do. I mean, I have a fairly well-rounded life, but I noticed every decision I make is kind of centering around this one topic. And I truly just wanted to have mental freedom from what I've been experiencing so far. And I was aware of the medical programs, and I went into it reluctantly, hoping to find something different, and thankfully I did. But it really came at a point where I had to be very open to doing things differently.
Aashni?
I feel there's so much overlap with both of your stories, and I know I've been hearing yeses from some of the folks in the audience, so I think a lot of this is resonating. Mine similarly also started when I was a kid. Our family is a very big Indian family. We eat together. There's like 25, 30 of us eating together all the time. So there's always an abundance of food. And most people in my family are also overweight. I was probably on the higher end of that. And so there was this sort of culture around, well, we're going to eat. And every now and then you'll hear the occasional auntie say, hey, maybe you should like cut back and not eat that extra chapati, or, you know, those side comments. They've always been there since we're kids, and we're programmed to kind of just ignore them, which is obviously not what we want to be doing, but it is reality. And then by profession, I work as a software engineer, and then now I work at a tech startup. And that culture is usually like, I work late at night. And what ends up happening is I snack a lot at night, and I eat a lot at night. And I'm working till 2 a.m., 3 a.m. because I enjoy doing that. But then I'm also eating at 2 a.m. before I go to bed, and then sleeping on that. And so it starts building a lot of these negative habits. Up until, I'd say, 2018, I didn't let it bother me so much because I was still physically able to do everything that I enjoyed doing. I would go on hikes. I love scuba diving. It's one of my favorite hobbies. And I've never had physical restrictions to do any of these. So while I know I needed to lose weight, I never really prioritized it over the other things I wanted to do. Then COVID happened. And we're now indoors, and I started working on my startup, and I ended up not going outside at all. And any weight loss that I might have done before that came back, and then some. And I'm sure many folks have experienced that, whether it's during the COVID period or not. And I remember going back home and spending some time with my family and seeing the progress my sister had made. She's never been as big as me, but in the sort of year I'd been away, she had really mentally put herself out there to focus on that, controlling her food intake and starting to focus on how much she's eating and exercising, that she had dropped 20 kilos. I think a lot of folks saw during COVID, you either went down or you went up. And so she had done an incredible job losing weight, whereas like every kilo she lost, I'd gained. And that was a really big eye-opening moment, because if she can do it, I can do it. The other thing that was happening around the same time is I'd already gained all this weight, and generally I'm a very social person. I love going out to networking events and tech events, but I stopped because I felt uncomfortable in my own skin. And I would go to these events and I would see people looking over me. I'm a shorter girl. I would see people looking over me while they're talking to me, trying to find anybody else in the room to talk to. And that was a slap in the face. And so that started making me go out less and less. And so my physical capabilities, like those physical blockers, started coming into my life. I couldn't climb up more than 1 or 2 flights of stairs. And all of those things kind of hit at the same point. And I think that milestone moment for me was my mom actually asking me, what can we do? And understanding and hearing the worry in her voice. And I think in the background, my head was in panic mode. And I hadn't verbalized it until my mom had asked me that question. Or I had not verbalized it, I hadn't processed what exactly it is I was feeling until my mom asked me that question. And that was the moment that made me go, oh, I need to do something about this, and I need help.
I can't think of any other medical condition that embodies this intersection between psychological impairment or paralysis of what you describe is like steeped in really strong internalized weight bias from our society, and physical impairment. Like you said, you were not only socially withdrawing due to your thoughts or perceived judgments from other people, but also being like physically impacted by your weight. So thank you so much for eloquently describing that. My second question for you, and maybe Shilpa, you can start with this, is discuss the challenges in achieving your health goals, how you overcame them, and the lessons learned. So when I talk about challenges in my own practice, I often say they can be environmental, behavioral, or cognitive, being like some of the thinking traps that might have come up for you. So,
Sure.
yeah.
Yeah, so I think for me, there was 2 large areas. One, because I was so entrenched in these commercial programs, was misinformation. All the information I had about this obesity and weight management was kind of junky information. And the second one was stigma, both external and internal. So of course, in the mainstream culture, there's a ton of stigma as it is for people with an elevated weight. For me, if I layer in the South Asian experience, growing up in, other than the dominant culture, so as a visible minority, I would say at home, kind of like Aashni mentioned, elders take a lot of liberties on making appearance-based comments as to young people. So that is something that was big, and my weight was a big family discussion often, to the point where also my family doctor, who was of a similar background, kind of suggested that maybe just one day a week I just don't eat. And so it made it feel like it was very much my problem to solve, and that too a problem, which is, another thing. But I felt that that was what was happening at home, and then outside of the home, because I was very much in an area where, like, we lived in a smaller town, I was very much othered for looking different, whether that be because of my racial background or for kind of being in a larger body. So what ended up happening was there was this lack of belonging. There was a lack of kind of feeling good enough, or there was, you just kind of felt demoralized or embarrassed. So I think that made that shame aspect really thrive, because I felt isolated. And ultimately, what was the antidote for that was community. So as I got much older, I was able to seek out various support groups, and I think being able to get a sense of connection with people who are going through the same thing, or may look different than me, but we have these common journeys, really helped me destigmatize everything for myself. And that was the beginning of having a much kinder headspace, a lot more gray area. And then the misinformation piece really came from working with really great healthcare practitioners who rooted their practices in a destigmatized environment.
Thank you, Shilpa. Thomas?
So this is where kind of I had to use my engineering background to figure out what my addiction is stemming from. So one of the greatest challenges is understanding that my overeating was actually a symptom, not the root cause. Once I started to realize that, I figured I should start paying attention to myself when I am undergoing that type of a behavior. So what I've noticed was I tend to disconnect when I'm eating hyper-palatable foods. Whatever feelings I have, whether it's guilt, shame, worthlessness, loneliness, it disappears for that moment of time. And it can only be achieved through specific foods. It can't be achieved with a salad. It can't be achieved with a piece of fruit. It has to be something very rich in carbs, fats, salts, sugars, etc. Once I realized that food became a tool to soothe whatever it is that I was trying to numb out, it was the first step in understanding that in order for me to really overcome this, I can't keep focusing on the symptom. I truly have to address the root causes, and that is the emotional escapes that I was seeking all the time. And the lessons learned from that was everyone, has something that helps them numb out or soothe whatever it is that they're feeling internally. Whatever emotions they're trying to suppress or not feel. And to me, the introspective work is what really helped me overcome my addiction to going to food first in order for me not to feel what it is that I was trying to avoid feeling. So the introspective work, a good amount of research, as you said, community, and being around people that truly understand it instead of judging it. Because, anybody could say, oh, in certain cultures you've gained some weight, or is everything okay? You wouldn't say that to somebody who's addicted to drugs or alcohol or anything else. It's typically, it's very easy to say something to a person who's gained weight, and you don't understand the kind of damage that it really does to them, because you're not looking at it as an addiction. You're looking at it, as somebody who just can't stop eating. But that's what truly an addiction is. It's overconsumption of a substance. So to me, understanding that everyone has something that they, tend to use to soothe themselves enabled me to first, normalize that this is not something that I should be ashamed of or anything. It's just a predisposition to it? And two, how can I make healthier choices to be able to identify first the triggers, and two, how can I feel as much of the emotions I'm trying to avoid and still be able to have a healthier relationship with food? Because that's what it was for me. It was developing a healthy relationship with food. And it took a very long time to realize that. So that's kind of the takeaways, Doc.
Yeah, you're describing a really distinct, what we call phenotype or presentation of obesity that stems from a really super excitable reward drive. And in this specific environment, like if you were born somewhere else without an ultra-processed food environment that was easily accessible, it might be different, right? But you're here and it's just so seamless and effortless to access those things and for your brain to be hardwired to like and learn them over time. So thank you for that description. Aashni?
Absolutely. So the 3 words that pop into my head with your question is stigma, support, and confidence. So stigma around, oh, you had something done, or oh, you're suddenly trying to lose weight, even though I've been told to lose weight my whole life. I'm getting laughs on
Can't
stage.
win.
Never can win. So there was so much stigma around people making comments on the approach I took, the decisions I'm making. And at first, I was very hush-hush about it. My family, my very extended family, all knew about it. But I kept it very quiet outside of those circles, maybe telling a few friends here and there. I think that was a challenge at first because it meant I'm hiding a big part of myself. My eating habits have completely changed, so it's not like you can go and socialize anymore unless you want to explain why you're carrying a tiny little container of food for the first 3 months. And that's when my mindset changed about this. This is me saying, hey, I'm making life decisions to make sure I live my life again, and I need that support. And I'm so grateful for the way that my friends, my family have reacted, and more importantly, supported me through this. My family in particular, right after we had a massive family get-together. I'm talking like a family reunion, like cousins were flying in from out of country who hadn't been around in like a year or two. And with our family, there's lots of food. And it's literally 3 days of any kind of food you could possibly imagine or want, just there, and I'm eating soup. And my family were the most supportive in terms of like what can we do? How can we help you with this? And it's those really small comments that they were making in support at the beginning that gave me that confidence to keep on going. And then the 3rd word I said is confidence. I started hiding from the world because I'd lost confidence in myself. And I had to make this mental decision that I want to regain that confidence. I've always been a relatively confident person. So for me to be hiding is not okay. And I now make conscious decisions to be as confident as I can, to make sure like when I dress, I'm wearing something that's loud. I'm not gonna hide anymore. I'm going to make sure I'm wearing a bright yellow dress. You can see me in the room. And that mental shift and that mindset has really helped make sure that I'm making decisions that help me continue to benefit from whatever decisions I made in the past and keep me in that direction.
That gave me goosebumps. Yeah, that gave me goosebumps. It's a good reminder that confidence is an inside job. It's not something that is conditional on a magnitude of weight loss, which I often encounter at the beginning of my consults. A lot of the times patients are saying, I need to lose this weight, and there's an urgency to it because I need to become confident again. But you've just nicely highlighted that confidence is such an inside job. And look at you, how gorgeous you look today.
Thank you.
Thank you for that. So my 3rd question is, what does success look like to you? Thomas, did you want to start with that?
Sure, absolutely. I'll just piggyback of what you just said. It's no longer, before it used to be just a number on the scale. You know, if you lose weight, you're successful. If you gain weight, you're a failure. But to me, what really determined success was understanding. Understanding, it's much deeper than mere information. Understanding yourself, that is. So once I started to understand myself, and my confidence was not actually attached to the way I look. The way I look was due to a lack of confidence. So in order for me to truly be able to, overcome the barriers that are keeping me from feeling confident, is to address the inside things that a lot of us, run away from, or a lot of us struggle with, traumas, triggers, etc. So for me, understanding became the optimal point in order for me to be successful in this, long life struggle with it, because no matter what, every day is a challenge. I can easily slip back into, my old habits. They say once an addict, always an addict. You're just in recovery. And it's one wrong decision away from slipping back into it. So for me, I understand that there are certain foods that I consider a drug. I simply will not even have a little of it. Bread specifically. For some reason, I can't handle bread. As soon as I have bread, it's game over. I black out, and then it's 2 large pizzas gone. And then I'm like, okay, wow, I can't handle the substance. So for me, I will not touch any kind of processed carbohydrates or processed foods in general now. So understanding what affects you and how you behave towards it is so important, because as everyone said here, there's so much misinformation. There are so many different programs. There's so many speakers on social media, TV, etc. And everybody is trying to sell you something. But nobody is going to be able to tell you who you are outside of you. So for me, that's what it was.
Thank you. Shilpa?
Sure. So one point you brought up that was really important for me is the scale. And success to me is being completely detached from the outcome. So I actually don't weigh myself, haven't for a long time. And that was very significant for me because it was something that was kind of triggering a behavior that wasn't helpful. So being detached from the outcome, and I think what's come of that is that I've had a much clearer, much quieter headspace, and that's kind of allowed me to pursue a lot of things in life that are much more important to me. So whether that be career goals or building on friendships, building new friendships, that has been something that's much more important to me, and I'm so glad I get to spend time thinking about that rather than all the other stuff I was thinking about before, which is truly just noise. And then I think the third thing for me is really, I'm not chasing the next goal anymore. I think in the past I would achieve something and try and be like, well, what happens if I just do one more size, or like, what's the next level? There was always this urgency or this push towards that. That has largely faded for me, and it's made it so that I guess that's self-acceptance of just, I'm good at weight stability. So long as I'm doing, kind of practicing the behaviors that are important to me and healthy, I'm good. So that's what success is to me.
Thank you. You reminded me of one of Sandra Ilia's quotes, which is about the rocking chair test. Like, what do you, when you're 90 years old sitting on a rocking chair outside, what do you want to be thinking about when you're sitting there? Do you think about the number on the scale that you were when you were 35? Or do you want to think about the experiences and the relationships you had with people and all of these other things that actually enrich your quality of life? So what about you, Aashni?
So brown girl, brown family. Success to me has always been books and good grades and getting a good job, getting paid well, climbing the ladder. And it's always been measured on career success. And I think in sort of 2019, 2020, I was hitting my milestone moment. I really started to evaluate what that meant for me. And I was looking at my life holistically. And I was trying to understand, what do I want my life to look like when I'm 30, when I'm 40, when I'm 50, when I have kids? I don't currently, but when I have kids. And a really big switch that went off for me is, I want to make sure I'm able to physically do the things that I love, like scuba diving, with my kids. And if I continue on this path, there's no way I'm going to physically be able to climb the 10 flights of stairs down that I need to, or to go scuba diving with my kids, because it's going to be physically dangerous. And that was a really big mental moment of, if I stay on this track, I love these things, I won't be able to do them with my kids. I won't be able to introduce them to these worlds that I've been fortunate to explore. And so my success, or what's that shifted with my outlook on success today is, what do I want my life to look like? Similar to what Shilpa said, I don't look at this scale in terms of I want to hit this specific numeric goal. However, I do look at the scale often to make sure that I'm not going the wrong direction. And that's something that I kind of mentally keep in mind. And then another thing that I've really tried to do is challenge myself. I'm a very goal-oriented person, and I find if I've got some sort of goal in my mind, that really helps motivate me and keep me on track. It's what my startup is all about, which is hilarious because my startup started before any of this did. But when I talk about goals today, I talk about what is a fitness challenge that I can do, what is a mental challenge that I can take. So in 2022, I decided to join a Bollywood dance group. I've referenced the fact that I'm Indian very often. That's not me in my normal day-to-day life. But I joined a Bollywood dance group, and it was so much fun. And we ended up putting a performance up after, I think, like 6 weeks of classes, which is amazing. And dancing in front of 2,000 people. Last year, I'm not doing math today. Last year, I decided to run my first ever 5K. And I did it, and I have the medal to prove it. And and this year, if you see me limping around at all today, I started something called the 75 Soft Challenge. And I started that on Monday. And my body is wrecked because it means going to the gym every day and really challenging myself. But it's not just about the gym. It's also making sure I'm reading a few pages every day and making sure I'm drinking water, making sure I'm taking mental breaks and taking time for myself. And that's what I really like about this challenge. And ideally, that's going to keep pushing me over the next few years as well, is picking a challenge that I can do throughout some period of time. And that's what success means, is being able to continue these challenges. And whenever I have my own little kids in the future, making sure that I'm able to get them to scuba dive or cliff jump or whatever it is that we enjoy doing.
So I have something that I always point out, and I came up with it myself. It's nothing clinical, but I write when somebody's making a lot of progress, I write inflection point, and the biggest inflection point I notice in my patients who I know are going to have predictably more durable, sustained weight reduction is when they actually uncouple their behaviors from the scale. And so as soon as I see that happen, there's just something that comes over them. There's just an inner calm, an inner peace, less noise, less distraction, because we have too much of that already. And people just focus on what actually makes them feel good. And the common theme to your answers was a reinforcement of values and identity, whether it's your fitness enthuse or whether it's important for you to just be able to live your life in a meaningful way. Those are things that actually continue to be substantiated by behavioral research to keep us going with the things that are actually important when it comes to our health. So my last question for you all is, what advice would you give to someone just starting their journey towards health and wellness? Aashni, maybe I'll start with you.
Sure. I think it's figure out what works for you. Because I think all three of us have had our own unique journeys, and every single person's journey is going to be unique. Maybe it's one type of surgery. Maybe it's another type of surgery. Maybe it is just, and I'm never encouraging this, but maybe it is reducing your food intake, but not to the point that you're not eating. It's just understanding why it is you're eating so much more. Some people have had incredible success, not necessarily going the medical route. Some people haven't. And it's just understanding and setting those goals and mindsets for yourself around what works for me, and more importantly, what is going to get me to that lifestyle that I want to be living. And build your support group. Find the people that you feel comfortable to talk about these things with. There's many people in this room today. And then your family, your friends, those people that you trust, make sure that they know this and are helping you. And if you're getting those negative comments from them, like, oh, maybe you should eat one less chapati, let them know that that's not a helpful way to say it. I found that conversation, especially with my mom, she would always try to bring it up, and she would do it in the way she knew how, but it hurt me. And when she and I had a really strong conversation around, like, I understand where you're coming from, but this is hurting me. Can we talk about it in a different way? It made a huge change. I said a lot of things, so I'm going to pass it on.
Thomas?
Like with some of the points you brought up, the first thing I would say to somebody who's, entering their journey of health and wellness is understanding, first and foremost, I keep bringing that up, understanding that if you have a weakness with food or whatever it is, understanding why that is so. Understanding also the underlying factors that cause it to happen, whether it's your emotions, your traumas, etc. That's very critical in being able to have a sustainable, successful outcome, right? There is no, one plan fits all type of deal where it's just reduce your calories here. As you know, and I'm pretty sure a lot of people have tried it, it's very short-lived. You'll try a program for a couple of months or a week or two, and then it doesn't work, and then you revert back to your old habits. So having that understanding is very critical. Also, access to good information. Like Dr. Van, what you do, for example, with medical intervention, or there are specific types of surgeries that you can elect to have, there are tools that can help you. There are options. You just have to identify what works best for you, and connecting with doctors and specialists like Dr. Van is critical, because they'll give you all the information that they understand due to your psychology, due to your background, what your addiction level is like. For me, VSG was the solution, and the reason for that is because I got to a point where I was having signs of hypertension. I couldn't function. I couldn't go up a flight of stairs.
VSG being vertical sleeve gastrectomy?
Yes. Basically, they remove 80% of your stomach. So you go from a 10-liter stomach to a 2-liter stomach. So you get satiated a lot faster. And for me, that was the thing that I struggled with, satiation. I needed copious amounts of food in order to feel satisfied. And now, 4 ounces of meat does it. Before it used to be 24, 30 ounces. So now it's way better for me. And I'm much happier because I no longer have to consume all that and feel that guilt. Now I have a very healthy relationship. And so that's all because of good information. And I gotta, give my sister a shout out, because she was the one that actually told me about this option, and potentially actually saved my life, right? And finally, what I would like to highlight is, I think a point that didn't come up, we all like science and logic and stuff, but I think there's a spiritual aspect to people who struggle with certain things, right? And one of the things that I realize is that everybody's assigned a struggle, everybody's assigned pain, everybody's assigned, my faith, we call it a cross to bear, right? And a lot of us try to solve it alone. And to me, one of the things that really helped me stay focused and have, now I'm in my 4th year, I would say, is the reliance on God, a higher power, to help me, understand that when you're on earth, you're going to have a struggle. When you're here, you're going to have pain to deal with. And, access to good tools, access to good information, access to good literature helps you understand why you have those, struggles and pains assigned to you, and how are they actually helping you. Because for me, my struggle, my addiction actually helped me in the long run. It was something that made me a better person. It's just I didn't know it when I was in it first. So that's one of the biggest piece of advice I can give. There is an absolute spiritual aspect to it.
Yeah, thanks for bringing that up, that added dimension of spirituality, because I do find that when patients come in with some sort of spiritual practice, whether it's just their self-directed meditating, it doesn't have to be faith, but there is this increased level of self-awareness, and not only that, self-compassion that comes along with their process. So they're much better able to demonstrate resilience in the face of setbacks and kind of just recalibrate shortly after, because they're not stuck in sort of the negative thinking cascade that can come along with some of the challenges. Shilpa,
Sure.
You'll be closing us off.
Sure. So as everyone suggested, success looks different to everybody. And I would say that to someone who's starting their journey, give yourself a lot of time, a lot of grace to figure out what that means to you. And I think misinformation is a big one that I experienced, and accessing healthcare practitioners or some of the resources that were presented earlier to help kind of recalibrate what good information is, or getting the right information. And the second thing is huge for me is community, is really surrounding yourself with people who you can relate to, who are kind of on the same path as you. And of course, everyone's path is different, but I really feel that finding that sense of connection will help declutter your mind from the stigma. So even if it's coming to events like this, if it's finding a community and a support group within your own existing friend or family circle, I think that will go a long way.
It takes a village of support. That's what I tell everybody. But you know what? Sometimes patients tell me, but I don't have anybody in my family who's actually supportive. So I just tell them, go and find people. There are people out there. There are groups. There are fitness communities. Just surround yourself with people who are supportive. And so thank you guys for sharing your stories today. I know that it puts you in a position where you're pretty vulnerable and sharing pretty personal things. And you'll notice that we intentionally did not speak specifically about the interventions that were used, because that's beyond the scope of this program. We really just wanted to highlight the milestones and the things that really help you overcome them. And common themes that came up were really just, developing self-acceptance, having a supportive community, giving yourself grace, and really trying to uncouple those success milestones from this scale. And so as we close this enriching session, I just want to remind everybody that every step forward is a milestone in its own right. It doesn't need to be that you've lost a ton of weight or that it needs to be years from now. I think that we often get lost in what could be or moving the goalposts, like you were saying, Shilpa. But we need to find success in everything we do every day, because when we can celebrate something, you're more likely to build on that, right? We don't build success off of a foundation of feeling like you're a failure, right? And I love this panel in part because we actually portrayed people who are super high functioning. Like, this is a really smart panel. Like, we got an engineer, we got somebody in finance, we got somebody to start it. So I feel like in society we tend to see people living with higher weight depicted in a much different way, but I think that more recently with Oprah's special, that it really highlights that there are people who are very high functioning who also struggle with their weight, and that it has nothing to do with a character flaw or a lack of willpower. And I always say this, lean people take credit for being lean, okay? They're born with a lean predisposition. People who live with obesity are the ones who are actually thinking about what they're eating, thinking about what they should be weighing all day long. That's all I hear all day long. And so if anything, I feel like the people who come to me have higher willpower than people who are lean, right? So anyways, in the symphony of health, this is a fun quote, each body plays its own melody. So tune in to what makes you thrive. All right?
I like that.
Thanks, guys.
Thank you, Sandy.